Welcome back to the channel, guys. I'm Dr. Marshall here with Medical Specialty Clinic, and today we're going to talk about erectile dysfunction. This is going to be part one of a two-part video series. Today we're going to talk about some of the more common oral medications to treat erectile dysfunction. In part two, we're going to go into some of the less common treatments that you may or may not have heard about. So I think today's video, most people have heard of the medications we're going to talk about. These medications are widely prescribed and very effective. Erectile dysfunction affects millions of men, not just in the United States, but all over the world. And I think that's the big reason for the amount these medications are used, is they're very effective, usually affordable at this point in time. Most insurances will cover one medication in this class, and there's so many people that, that need the assistance of these medications. So the two medications we're going to focus on today, there's several others in the class of phosphodiesterase inhibitors. That's how they work. That's what they're called. The two we're going to talk about today are Sildenafil and Tadalafil. So Sildenafil is the generic name for Viagra, or the little blue pill as it's affectionately called. Tadalafil is going to be the generic for Cialis. There's a few differences. First, we're going to talk about Sildenafil. So Sildenafil is typically taken on an as-needed basis about 30 to 60 minutes before sexual activity. The usual starting dose is around 50 milligrams, but it can be adjusted as needed for effectiveness. The dose ranges typically from 20 milligrams up to 100 milligrams, but you should never take more than 100 milligrams in a 24-hour period. Often, insurance usually will only cover the 20 milligram, at least that's what I see in my practice. However, if that doesn't work, then you can a lot of times get them to cover the higher doses. But every type of prescription drug coverage varies, and you may have to try a different medication in that class. But usually you can get one covered at a reasonable price under your prescription drug coverage. It's important to note that Sildenafil works best when taken on an empty stomach. High-fat meals can actually delay its absorption, making it less effective. Of course, it's taken as needed, so that can cause a little problem. You have to anticipate when you're going to need it and change your diet based on that to increase absorption. But just wanted to go over that key point and mention that. So now let's talk about Tadalafil. So this works a little bit differently. It has a much longer half-life, and unlike Sildenafil, Tadalafil can be taken in a low dose every day or on an as-needed in a higher dose. So for daily use, the typical dose is 5 milligrams, and this allows for spontaneous sexual activity because the drug stays in your system 24 to 36 hours, and it's kind of always there in the background working, and it's ready when you are. For the on-demand or as-needed use, the recommended starting dose is 10 milligrams, but I find that most men take 20 milligrams, depending on how well it's tolerated. One of Tadalafil's advantages is its much longer half-life or duration of action, which gives you a little more flexibility. Because of this, you should still avoid taking this more than once a day. Also, it's important to note that these medications can be taken together under certain circumstances. You should always discuss this with your physician first, but there are a lot of people who will take the 5 milligram Tadalafil every day, and then on top of that, they can take a 20, 50, or even 100 milligram Sildenafil as needed. So I've seen urologists recommend this from time to time. There's actually several people that do this, and that actually works even better than individually taking these medications. So just wanted to pass that pearl along. Just be aware, you got to be careful. Additive effects of two medications that work the same way put together, but those can be taken together in certain circumstances. So both medications can be effective, but they also come with some potential side effects. The most common is headache. You can also get flushing, some indigestion, nasal or sinus congestion, and sometimes dizziness. In some cases, people may experience some vision changes, such as blurred vision or sensitivity to light. Tadalafil specifically can cause muscle or back pain. The vision changes are a little more common with Sildenafil. These side effects are usually mild and go away on their own when you stop the medication, but it's important to talk with your healthcare provider if you experience anything severe, or certainly if it's persistent. Now, one very important warning, these medications should never be taken with nitrates. That is critical. Nitrates are often prescribed for people with chest pain or heart problems, and when combined with Sildenafil or Tadalafil, they cause a dangerous drop in blood pressure, which can be life-threatening. Symptoms of dangerously low blood pressure can include dizziness, fainting, or even a heart attack in some cases. So if you're on medications like nitroglycerin, isosorbide dinitrate, or any other nitrate, make sure to tell your doctor before considering these erectile dysfunction medications. Both sildenafil and tadalafil can be great tools for managing erectile dysfunction, but as with any medication, it's important to use them safely. Make sure to talk to your doctor about which option might be best for you, especially if you're taking other medications or have underlying health conditions. If you found this video information helpful, please like and subscribe to the video. It really helps the channel, and we'll try to get some more health-related content out here from Medical Specialty Clinic. If you have any questions, leave them in the comments below, and we'll do our best to get back to you. Thanks for watching. Look forward to seeing you in the next one.